Okay, make sure our sound's on. Oops. All right, we can see you. Okay. Hi, Rich. Today I'm going to be performing a head-to-toe assessment on you. To begin, I'm going to go wash my hands and clean my stethoscope with alcohol, and then I'll do some draping and we'll go head-to-toe, okay?
Yes.
Okay. My stethoscope is here, cleaning with alcohol. Okay, I'm going to wash my hands. Okay, so this is a pretty long assessment, so I'm going to be using my checklist just to go over things so we don't forget anything, okay? So for privacy or by yourself, we'll be doing some draping, so only exposing the area that we need to be using. There should be good lighting, it looks pretty good right now. And my name is Monica and I'll be doing the assessment on you, and this is Rich. Okay, so I'll be assessing the patient's appearance, posture, facial expression, and level of consciousness. Tell me your name and date of birth.
Richard Georges, 12/13/88.
Perfect. Do you know what today's date is?
Yes, it is.
Do you actually know what today's date is?
Today is Monday, May 11th.
I think it's the 13th.
Oh, 13th.
Close. That's what happens when you work nights. Sorry, Julian. Anyway, so facial expression is cool, calm, collective, alert and oriented. For level of consciousness, posture is calm and relaxed. Appearance is well taken care of. Next, we will be doing a set of vital signs, which would include a temperature. Depending on where you're doing that, you could do a tympanic, you could do one under your arms, the axillary. You feel cool and okay right now, not
Yes.
too warm, not too hot, no fevers. Okay, great. Blood pressure would be on the right and left arm, using a cuff that's correct size. With this arm, be wrapping it around here, listening with your artery here, and doing one on the right and the left side. Right now, temperature is good. For respiratory rate, you want to count that for 60 seconds in and out to see what our rate is there. Radial pulse, radial artery here, which I will perform right here. And count for 30 seconds times 2 or 60 seconds. Pulse is palpable, good rate, strong pulse. Can I see your other arm? Radial pulse. Strong palpable pulse. Great, moving on to our skin here. I will be assessing different parts of your skin for A, B, C, D, E, and that is asymmetry, borders, colors, diameters, and evolving diameters, okay? Let's see. I'll be expecting and palpating the skin throughout the exam, as I said, using the dorsal side, so the back of my hand. I'll be assessing the upper and lower extremities, right and left, which I will do now, and then assessing skin turgor underneath the clavicle, which will be a pinch and a check there. Okay, so back of hand. Good, nice and warm. This side, upper extremities are nice and warm. I'm just going to expose here, okay? Lower extremities, I'm not sure if you can see feet here. Both extremities, a little cool for the feet, but nice and warm. Okay, so for skin turgor, exposing the clavicle here. Hopefully you can see this pinching just a little bit. Good skin turgor, sorry about that. All right, let's see. For the head, I'll be inspecting the temporal lobes simultaneously. I'm gonna have you just take off your glasses really quick because we're gonna do eyes as well. Great, so temporal lobes right on the side of each eye at the same time. Inspecting the head. No lesions, no traumas. Skin looks good, hair looks good. no abrasions, ulcerations. Okay, palpating the jaw. So I'm going to put my hands and check for TMJ on the sides of your jaw. We're going to have you move your jaw to the sides, okay? Go ahead. Perfect. Any discomfort with that?
No.
Great. Okay, looking at the face, I will be assessing symmetry of the face, the palpebral fissures and the nasolabial folds. Palpebral fissures are the inside of the eye, which are right here. They look good right near where you cry, tear ducts. And then also your smile lines. That's what we call your smile lines, the nasal folds. Perfect. Symmetry of the face is symmetrical. You can look straight ahead, open your eyes. Perfect. Everything looks good. Eyebrows, everything look perfect. Let's see. Moving to the eyes. I'm going to be pulling down your lids to check your conjunctiva. Perfect. No redness. Hopefully you can see this. They both look good. Oh, I'm sorry. I'm going to pull down and have you look up. Perfect. I should have said that. Okay, I'm going to dim the lights and I'm going to assess for Pearl, which is pupils are equal reactive round and, reactive to light and accommodations. So I'm going to use, I don't have my pen light with me, so I'm going to be using a flashlight just to assess both eyes, the right and the left. So I'm going to dim our lights. That should be good. All right, so what I'm going to have you do is look straight ahead and just kind of open your eyes a little bit more. I will be doing the left first and then the right, okay? Perfect. One more time just in case. Great. Perfect. And I'll turn the lights back on. You can shut that off if you want to. Pupils are 3 and breast round and reactive to light. Okay, so EOM, is extraocular movement or motion, which is all the muscles in the eyes that allow you to move your eyes in different directions. Next, I'm going to have you look at my fingers. We're going to make an H and see if you can follow, okay? Straight ahead, up, down. You want to keep your head where it is. Just move your eyes. Perfect. Perfect. So everything moves good there. Next, we're going to move on to the ears. So I will be assessing the tragus, which is the top of the ear. I'll be assessing the top of the ear, behind the ear, and in the inside of the ears, okay? Any pain or discomfort?
No.
No tenderness. Okay. Next, we'll be performing a few different tests. The whisper test, which is where I will have you cover your left ear. And then, actually, I'm closer to your left. I'm sorry. I'll have you just cover with one finger. Just one. Perfect. Your right ear. And I'm going to stand 1 to 2 feet away and whisper 2-syllable word to you and have you repeat it. Okay? Understood? Okay. So you're covering the ear. I'm standing away so you can't read my lips, and I'm going to whisper something in your ear. What did I say?
Miami Beach.
Miami Beach. Perfect. Okay, great. Let's see. The Weber test is another, you can put your hand down, is another screening tool. I don't have one with me, but you'd be using a tuning fork. You would strike the fork, you place it on the forehead of, you place it right here in the middle of the forehead, and you ask your patient if on the left or the right side there's any difference in hearing. And what that actually does is it helps you determine any type of hearing loss that's more significant on one side. Okay, let's see, moving on to the nose. We'll palpate the nose, inspect the nose, and look at the sinuses. So the frontal sinuses are actually above, you can look straight ahead, are right above your eyebrows here, kind of where your frontal lobe is as well. The maxillary sinuses are right on the sides of your nose here, so when you have like a sinus infection, you can feel a little bit of extra fluid in that area. So I'm going to palpate those. Any tenderness when I'm touching?
No.
How about down here?
No.
Great. All right. And the nose itself looks good, the external nose. No traumas, no swelling. Okay, we're gonna do the teeth now. So I will be using a tongue blade. At one point, we'll have you open your mouth, stick your tongue out. I'll use the tongue blade and I'll have you repeat ah 3 times, okay?
Okay.
Okay, and what that is actually doing is observing for uvula rising symmetrically. Okay, so we have our sterile tongue blade here. I'm going to have you open your mouth and stick your tongue out. I will use the tongue depressor and have you say ah. Can you say ah? Perfect. And then stop. Say ah, ah, ah 3 times.
Ah, ah, ah.
Perfect. Any swelling, tenderness, anything with your tonsils? Any complaints there?
No.
Okay. Everything looks symmetric. Now the neck will be looking at the trachea. So I'm going to have Rich sit forward. I'll be behind him, and I'm going to assess the right and left side of his trachea and look at his thyroid glands. I'll just have you move a little bit. Sorry, I'm draping. So I'm going to have you kind of turn to this side if you can. Or you know what? You can sit back. That's okay. You can sit back and I'll, like that. Perfect, perfect, perfect. All right, so I'm trying to come behind here. I've got my left and right hand on each side of his thyroid gland. You can just put your head down, and I'm going to have you swallow. And swallow again. All right, they both feel good, not swollen or anything. I'll have you sit all the way back, and I'll assess the trachea. Just have you look up just a little bit. Good, trachea is not deviated, it's right in the middle. Good. Okay, using my, the bell of my stethoscope, so this part of the smaller part of the stethoscope, I'm going to assess your left and right carotid pulses, and then we'll assess for a carotid fruit, okay? Okay. All right. All right. You can look straight. All right, deep breathe and hold. Good, for the left carotid. Deep breathe and hold. For the right, and then the carotid root on the right. Perfect. I'm sorry, that's your left, excuse me. I haven't lined my left from my right yet. Okay, now we are going to look at all of the lymph nodes, which there's a lot of them. So we'll kind of go in order, probably so Joanne can see you. I'll just have you put your neck up here. Perfect. So preoculars right here, postoculars right behind that, occipital kind of towards the back of the neck and head here. There's superficial cervical lymph node, posterior cervical lymph node on this side. Tonsillar, right where your tonsils are. Let's see, the chin is your submantle. Kind of under where your wisdom teeth would be is your submandibular lymph nodes. You've got your deep cervicals here and your supraclavicular, right near the clavicle. All right. All right, so now I have you stand up so we can do the thorax and lung assessment, okay? Thank you. So using, actually I'll have you look that way. Sorry. Trying to make sure you're in the video here. Okay, so I'm going to go to the level of the 10th rib. We're just gonna kind of feel for there. And we're gonna pinch and have you do some inhaling and exhaling, okay? Yep, nice deep breath. So you can see that skin kind of moving in and out between my hands. Okay, so that's the 10th. pinching the skin, and it's symmetric expansion. What else do we need to do? So assessing for tactile fremitus, I will have you, Rich, say 99 when I am listening and when I'm feeling, okay? So we're gonna start here. You're gonna say 99 every time, like
Okay.
10 times, go for it.
99,
Good,
99, 99,
good,
99, 99,
good.
99,
And then
99,
4,
99,
4,
99,
and
99.
5. Perfect, and now I'm gonna take a listen. We're gonna repeat that while I'm listening. So we go in an order of 1, 1, 2, 2, 3, and kind of go back and forth that way. Okay, go for it.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Excellent. All right, we're gonna do some percussing. So using my fingers here, using the middle finger to tap kind of two times on each side, okay? Does she want you just percussing lung fields in the upper and lower? Okay, so you don't actually have to say anything. Okay, now I'm just gonna listen. You can breathe in just normally for the posterior thorax only. So we're gonna listen in 3 different spots. And also using the diaphragm, so the bigger part. Okay, just normal breathing. Okay, great. Now also listening using the diaphragm of the stethoscope with our patient breathing in and out. I'm going to listen to 2 sides of the lateral lobe on one side. So lateral is right under the arm here. So Rich, I'm just going to have you put your arm up a little bit and be listening right here, the upper and lower portion. You can put it down, I just have to listen. Perfect. Nice deep breath in and out. Good. Excellent. All right, and I'm gonna have you turn around and we're gonna do the anterior thorax, listening in 3 different places, kind of the same direction of the, diaphragm of the stethoscope. Good job. Perfect, everything sounds nice and clear. Okay, now you can sit right back down and we're gonna move on to the heart. We'll continue to do some draping. Thank you. All right. Using my fingers, I am to locate the apical pulse, which is at the 4th or 5th intercostal or midclavicular line. So we're right here. We're kind of using 1, 2, 3. It's right about here. Great. 5th. We're going to listen to the heart using the diaphragm of the stethoscope as well as the bell and identify all 5 different landmarks. First, using the aorta, which is the 2nd right intercostal space, and then pulmonic, which is the 2nd left intercostal space. Kind of right here for the left, 2nd left, and 2nd right. And right is the aorta, and 2nd left is the pulmonic. Okay. So identifying them all, we will look, listen, and feel at the same time. Okay. So 2nd right is the aorta here. 2nd left, pulmonic. 3rd left is our Erb's point. 4th left is our tricuspid. And then 5th left is our mitral valve. I'm sorry, the bell and the diaphragm. So now I'll go to the bell, smaller part. Same thing. So 2nd right, 2nd left, 3rd left, 4th left, and down to the abdomen. So I will have Rich kind of come down a little bit and we'll expose only the abdomen. So Rich, I'll be inspecting the 4 different quadrants of your abdomen and doing some palpation during this exam, okay? I'll be looking for contour of symmetry of the abdomen, and I'm supposed to look from 2 points from the side of the abdomen and from the feet. Good, I don't see any masses, everything looks pretty symmetric. Okay, we're gonna use our stethoscope, and I'm gonna get in the camera here, and we're gonna listen, starting with the right lower quadrant. So right lower, right upper, left lower. That's kind of the how we're gonna go with this exam. We're starting at the ileocecal valve and moving up and over. Bellow stethoscope. So right lower quadrant, right upper quadrant, above the belly button, left upper quadrant, and left lower quadrant. Okay, so we've auscultated all 4. Also using the bellow stethoscope, we're going to auscultate the aorta, renal, iliac, and femoral arteries for Brug's, and we're going to listen on both sides. So our aorta, listening for that using the bell, is above our belly button, kind of near the xiphoid process here. On both sides for renal, so it's where your kidneys are. They're kind of on the sides of your belly button, but above them. So the left and the right, both sides. The iliac on the right and the left are just under the belly button. And the femoral, of course, is near the femoral artery and vein, so going towards your leg, below the belly button on both sides. Okay. So we're gonna be percussing now and then palpating. So looking for tympany, which is like a drum-like sound, for the organs to see if they're dull at all. So same thing, right lower, upper, left upper, left lower. Okay. So doing some percussing, same thing as we did before with one hand in the tapping. Sorry. Okay, now we're going to do some light palpation and deep palpation. So light palpation is usually 2 centimeters deep, and deep palpation, feeling for deeper organs, are 4 centimeters deep. You would do this last, you would do tender parts of the abdomen if there were any last, just to decrease discomfort. So any abdominal tenderness?
No.
Okay. So some light palpation, just kind of go from right lower to right upper, across the abdomen. Left upper and left lower. Sorry, no discomfort with any of those. Okay, moving on to peripheral vascular. I'll be inspecting the upper and lower extremities for hair distribution, edema, varicosities, and ulcerations. Now we'll kind of drape you here and just look for on the upper extremities. Okay, so left and right arm. Hair looks good, skin looks good. No ulcers, no edema, no swelling. Now looking at the lower, so kind of just draping everything but our legs here. Perfect. One more. Same thing with the feet. No edema noted there. We're now going to move on to palpating the pulses. So both the femoral artery and the inguinal nodes on just one side. So the nodes are a bit above the artery, so we'll point those out on this side. Just going to move this down a little bit, okay? Sorry. Okay. So those would be located, the nose would be more up top, and the arteries right down here where you can actually feel a pulse, where they do a lot of cardiac caths. Okay. And we would verbalize the amplitude there, which is normal. Okay, now looking at some pulses. So the popliteal, which is behind the knee, which I will show you, but you can just put your legs out straight, both of them. Perfect, like right behind the knee here. That feels good. Good strong pulses. Dorsalis pedis, which is like the top of the foot. Hopefully you can see this. Top of the foot. And posterior tibial, which is like the inner side of the ankle here. So, like right in this area. Okay. I'm going to assess for cap refill. So you just want to squeeze one toe. Cap refill is good. It's less than 3 seconds. Moving on to musculoskeletal, we're going to look at the joints of the upper and lower extremities. So upper extremities include your elbows and wrists. We'll look at those, and then lower extremities, your knee and your hip. So looking at our arm, do I need to do this bilaterally? Yes. Looking at the size, contour, and any deformities of the elbow or the wrist. So we'll start with this one. Nope, you're good. Not yet. Good, and same thing with the wrist, we can move it. Perfect. And how about this side? No pain bending your elbows.
Nope.
Good. Moving the wrist around and the fingers. Perfect. Okay. Looking at our lower extremities, so our knee, ankle, and foot joints, both sides, so the knee, I'm going to have you bend and push my hand. Good. So with and without resistance. And ankles, and our foot looks good. I'm going to do the same thing on this side. Sorry. Good. And you can push. Good. Move our ankle around. Excellent. Okay. Now I will actually have you stand up, if you don't mind. We're going to do our elbow first. So we'll be doing flexion, extension, abducting, and adducting, okay? So using our elbows first, we're going to push and pull against some resistance. So we're testing our range of motion. And then I'm going to have you put your hands by your side and bend your elbows to your shoulders and then back out. And then from the side, we're going to put your hand, just do one, or actually just do this one. Put your hand above your head, like all the way out. Good. And back. Now, put your hands out for me. I'm going to have you push my arms. Good. And I'm going to pull. Pull them back. Yep. Pull this back. Good. And push. Good job. Okay. So the knee, what we're going to do is have the same thing, abduct and adduct, and flexion and extension. So for the knee, you're going to stand in place and you're actually going to kick your leg out as if you're like kicking a soccer ball and pull it back, like as if you're kicking your butt. Go for it. Good. Good. Can you do that on both sides? Great. And the abduct and the adduct is when you're actually going to look straight ahead and you'll be like pulling your hip out. So that way, okay? Like you're doing a split. But you want to stand straight. Good job. Excellent. Any pain with that? Good. I'll have you sit down. I'm sorry, I lied. Now we're going to look at your back. So I'll have you face that way. And we're going to have you twist. So you're going to, twist from right to left. Good job. And you're going to bend and touch your toes and stand back up. Perfect. Okay, so now looking at the spine, we're going to be assessing for scoliosis, lordosis, and kyphosis. And I'm going to be palpating the spine from the top to the bottom. So just kind of feeling all parts of the spine. Inspecting and palpating. Good, and now I'm going to have you put your hands to your side and bend over to your toes, going kind of slow. Good. Perfect. And one more time. Great. Okay. I think you're able able to, yep, you can sit down. We're going to move on to neuro, and I'm going to have you assess for shoulder shrugs against resistance. So I'll be putting my hands on Rich and having him do some shoulder shrugs, okay? Go ahead. Good. Good strength. Now I'm going to move on to having him squeeze my hands and assessing for strength bilaterally. Good. That's rated on a scale of 1 to 5. So good strength. Now we're going to check for sensory. So I'm going to be using a little cotton swab here and touching different places. I'm going to have Rich close his eyes, and when I touch those places, he will tell me when he can feel them. Okay? Okay. When I touch a place, you're going to say now when you feel it. Okay?
No.
Good.
No. 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 No.
Good. So those included the forehead, cheek, chin, upper arms, and lower extremities. Now I'm going to have you open your eyes, and we're going to have you smile. Good. And frown. Perfect. Close your eyes really, really tight. Good. And open. And then try to puff your cheeks out. Good. And when you close your eyes this time, you're going to close them really, really tight, and I'm going to try to open them. Good. Good. Okay. Now I will have you stick your tongue out midline, just straightly out. Good. And put it back in your mouth. One more time. Good. Put it back. And tongue is midline. Now I'm going to ask you, this is assessing for clarity, so I'm going to tell you 3 words and I want you to say them back to me, okay? So the 3 words are light, tight, dynamite.
Light, tight, dynamite.
Good.
Dynamite.
One more time. Say
Light,
them differently.
light, tight, dynamite.
Great. Okay, next I'll have you sit up and we're going to do the finger to nose test. So what that means is eyes will be open, I'll be placing a finger in front of you, and what you will do is go from your nose to wherever my finger is in 3 different places. Okay? So you will touch your nose and then touch me, and then touch your nose and then touch me in 3 different places. Okay? So we're just about 1.5 feet away. Good. And touch me. Good. Good. Excellent. So 3 different places. Next I'm going to put something in one of your hands and in the other hand, 2 different objects, and you are going to close your eyes and tell me what it is. This is looking for stereogenesis, which is putting an object in your hand without seeing it before and telling me what it is based on information you have known before this assessment, okay? So starting with one hand, so the right side.
Coin.
Perfect. It's a quarter. Next is our left hand. What is it?
A lighter.
A lighter. Correct. A lighter. Perfect. The next one, we're going to keep our eyes closed. Same thing, right and left arm. I'm going to write a letter on your hand, and you're going to tell me which letter it is. Okay, so using like a pen or Q-tip or something. That's looking at graphesthesia. Okay, so we'll do our right hand first.
A.
Perfect. And then we'll use our next hand.
M.
Perfect. Okay, now looking at our deep tendon reflexes, what you would be doing is using one of your little reflex hammers to assess each area. So the upper arm is biceps, triceps, and brachial radial. So the brachial radial is kind of your forearm here, and you would be hitting that area and looking for a deep tendon reflex there. As far as your biceps, so kind of the inner part of your arm where your elbow bends, same thing, you'd be hitting that and looking for a deep tendon reflex. The last one is the tricep. I'm going to use the back of your arm here so you can bend your arm. Perfect, and you'd be hitting, kind of having your arm like this, and hitting and waiting for a deep tendon reflex there. The leg is the patellar reflex. So at, well, I'll do the Achilles first. So the Achilles, so you can see it, is right near your Achilles tendon, so the back of the ankle here. While sitting up, you would use your reflex hammer to hit there and assess for deep tendon reflex. Also sitting up, which I'll have Rich do after, knee would be bent, kind of sitting at the edge. You would be doing a patellar reflex right under the knee, hitting pretty hard under there for a deep tendon reflex, okay? So I will have you turn to the side and just perform that quickly. Good. So the patellar again under the knee. Perfect. And then Achilles underneath your Achilles tendon. Perfect. Okay. Let's see. Oh, we have 2 more tests to go. So the next test, we're almost done, is the Romberg test. So you're going to end up standing up, and what you will do is feet will be together, hands will be at the side, closing your eyes, and we're going to have you put your arms out. Okay, so I'm going to guard you just in case you were to fall. So feet together, okay? Hands at your side, eyes are closed. Okay, and you're going to put your arms out straight, and we're assessing for any, perfect, for balance, and you can put your hands down. Great. So you have good balance, no swaying or loss of balance. The last test we're going to do is the tandem test. This is what they use for like a lot of breathalyzers. So what you're going to do is heel to toe and walk a straight line, okay? Perfect, perfect. Heel to toe, heel to toe. Great, excellent. So no problems with balance or coordination. Okay, so now I'm gonna wash my hands and our practicum is finished. Thank you so much for all your help, okay? Great, thank you.